The Oxford chapter is an exploration of the possible reasons why so many Jewish women were involved in the development of the profession of dance therapy in the United States. There were quite a few non-Jewish women also involved in this development, and this study is in no way meant to diminish their contributions. And in addition, this study does not maintain that these women discovered dance therapy, the healing aspects of dance. That, of course, has been a part of most cultures since the beginning of time. This is an examination of the process that these women went through as they contributed to the development of the healing aspects of dance into a viable discipline and profession in the 20th century. It is remarkable that Jewish women played such an outsized role in the development of dance therapy in the United States. Even though the founders of the field, notably Marion Chase on the East Coast and Mary Whitehouse on the West, were not Jewish, the majority of the first generation of leading dance therapists who began working in the 1940s, the 1950s, and the early 60s had Jewish backgrounds. These original women include Janet Adler, Irma Dasamontes Alperson, Bea Becker, Cynthia Barrow, Ruthanna Boris, Norma Canner, Mara Cappy, Sharon Chaiklin, Joan Chodorow, Blanche Evan, Joanna Gewirtz Harris, Beth Kalish, Stephanie Katz, Susan Kleinman, Marcia Leventhal, Lee Strauss-Mislansky, Nitza Brody Miller, Iris Rifkin Gaynor, Elizabeth Rosen, Susan Sandell, Claire Schmace, Roberta Schlossgow, Elaine Siegel, Arlene Samuels Stark, Shirley Weiner, Alyssa K. White, Rhoda Winter Ellis, and me. Certain social factors seem to influence many of us. In particular, many of us had ties to New York City, where a network of Jewish communal and cultural organizations, including the 92nd Street Y and the Henry Street Settlement House, hosted social, political, and artistic programs. These organizations offered excellent dance programming at a time when institutional support for modern dance was rare. They often linked dance and the arts to larger political messages of personal liberation and collective social good, themes that would become resonant for many pioneers of dance therapy. Perhaps also significant in light of their future therapeutic work, many of these early leaders in dance therapy grew up in Jewish communities marked by profound trauma. Many had parents who had fled poverty and entrenched anti-Semitism in Europe. One early dance therapist, Lee Strauss-Mislansky, had herself escaped from Germany as a child with her family. Another first-generation dance therapist, Elaine Siegel, wrote a book about her childhood in Nazi Berlin. These Jewish women, who were, in a sense, the mothers of this new profession, established practices, organizations, and theoretical frameworks that remain influential today. Their contributions include the early dance therapy master's programs at Hunter College, Claire Schmace and Alyssa White, and New York University, Marcia Leventhal, Iris Rifkin Gaynor, and myself, the dance therapy, and then the creative arts therapy department at Bronx State Hospital, Alyssa White and myself, and a book, Foundations of Dance Therapy, about the life and work of Marion Chase, which was written by Sharon Chaiklin and Susan Sandell. Later, some of these women founded other master's degrees programs, including those at Hahnemann Medical College, Beth Kalish, and Lone Mountain College, Joanna Harris, Goucher College, Arlene Samuels and Sharon Chaiklin. Iris Rifkin Gaynor was a protege of Blanche Evans, a very early pioneer who did unique work with neurotics and children and did much to spread her work. Ruth Anna Boris had been a Balanchine ballerina, and her ballet background deeply informed her dance therapy efforts. Joan Chartereau and Janet Adler created a theoretical perspective of dance therapy based on several Jungian concepts. Cynthia Beryl and Stephanie Katz researched the effect of dance therapy on those with head injuries. Janet Adler and Beth Kalish did important work with autism. Elaine Siegel created a theoretical framework based on psychoanalysis. Irma Alperson developed a theoretical rationale for dance therapy based on Eugene Genlin's concept of the felt experience. And most of these first-generation dance therapists were founders of the American Dance Therapy Association in 1965. Jewish dance therapists were also strongly represented among the next generation of influential leaders in the field as well. And two of them are our panelists today, Lenny Serlin and Marcia Kalina. And also I want to mention that there are many dance therapists in Israel. In fact, there are more per capita in Israel than in any other country in the world. Many of these first and second generation dance therapists were president of the ADTA, editors of the American Journal of Dance Therapy, and members of the ADTA Board of Directors. Most served on the faculties of new master's programs, worked as clinical staff members at psychiatric facilities, or both, and many of them specialized in developing original methods for working with specific populations or diagnostic categories. So in light of this history, it is worth considering whether any distinctly Jewish values affected and continue to affect the evolution of dance therapy. Did these women's Jewish backgrounds influence their approach to the field? Are there connections between Jewish values, experiences, and traditions and the development of dance therapy in the United States? What can we learn by considering the connections between Jewishness and dance therapy?